I'm Dr. Vivian Lowe. Welcome to VLMD Rounds, a podcast on medical science and tools to optimize your health. Those of you who are watching on YouTube, you'll see I am at an offsite location again. And so I've got my notes everywhere. I'm going to try to stay as organized as possible. It's not easy when I don't have my usual setup. But this January is the 10th anniversary of Dry January, which started actually in the UK. And now, of course, there are other countries that are participating, and some of the official partners are Switzerland, Germany, Norway, France, and also the US. So in 2021, 13% of Americans said that they were participating in Dry January, and this was up from 11% the year before. Most of them wanted to just be drinking less, and 49% of them felt that they had drunk too much during the pandemic. So they were hoping this would be an opportunity for them to reset their drinking. Well, this episode is focused on alcohol, and you can bet I'll be giving you plenty of reasons to stop drinking alcohol. So let's go. We'll start with the metabolism as usual. And so the chemical name for alcohol is ethanol. So I'll be using them interchangeably, right? I'll say alcohol or ethanol. Now we have the enzyme alcohol dehydrogenase, and this enzyme will convert the ethanol to aldehyde, right? And once we have the aldehyde, we're going to further break it down. So there's another enzyme called aldehyde dehydrogenase, and that enzyme will take aldehyde to acetate. This is the most common way that alcohol is broken down in your body, primarily the liver. So again, ethanol with the enzyme alcohol dehydrogenase becomes aldehyde. Aldehyde is now broken down further by aldehyde dehydrogenase, and then we end up with acetate. And then acetate actually eventually can become acetyl-CoA, and we can use the acetyl-CoA for a number of things in the body. We can make fats, we can enter the Krebs cycle, right? So that can be very useful. Now, besides this main way of breaking down alcohol in your body, there are other enzymes that can also break down alcohol. The other main one is going to be part of the cytochrome P450 system. And cytochromes P450, they are really all enzymes that are part of a superfamily of enzymes that are related to breaking down foreign substances in your body. They're also involved in hormone metabolism and, oxidation of fatty acids and so forth. But, we often think of them in relation to breaking down foreign compounds in our bodies. And this might be in the form of medications that we ingest, right? So you take your medications and your liver breaks it down through this system. And it could be in foods that we ingest, maybe contaminants in food, right? So this, cytochrome P450 system is really important in detoxifying your body. And there are enzymes within this family that will also process alcohol. In particular, the enzyme is cytochrome P450 2E1. And that's a long name, so we often will abbreviate it to CYP2E1. Okay, so CYP2E1 is membrane bound and it's highly expressed in the liver, as I said. Now, in the fetal liver, it actually may be the primary way by which alcohol is metabolized, right? For adults, and most of us were using that alcohol dehydrogenase and aldehyde dehydrogenase, but in the fetal liver, This is where CYP2E1 might become the primary metabolizer of alcohol, which is why alcohol is so devastating to fetal development in the womb. And that's why, really shouldn't be drinking during pregnancy. And with alcohol, your body regards it as a toxin, right? And that's why we engage the cytochrome P450 system to eliminate it. But your body will also prioritize the elimination of toxins over metabolism of other macronutrients. So, when your body sees alcohol, its thought is toxic, toxic, got to get rid of it. And that's going to be the priority before metabolism of anything else. Got to get rid of the poison first. There is a medication called disulfiram, disulfiram. Disulfiram, it's also known as antabuse. And disulfiram, when you take it, is going to inhibit aldehyde dehydrogenase. It also inhibits the CYP2E1 enzyme as well. Okay, so we inhibit those enzymes, and what happens? As a result, people have symptoms such as head throbbing or headaches, flushing, that's very prominent, nausea, vomiting, in fact, a lot of vomiting. They may have shortness of breath, difficulty breathing, respiratory depression, abnormal heart rhythms, and maybe even in severe cases, heart attack. Okay, so these are the symptoms that one would have if you took disulfiram in conjunction with alcohol. And the reason, as I said, is that the disulfiram, by inhibiting those enzymes to break down alcohol, we are actually not allowing your body to break down the alcohol. The disulfiram actually competes with those enzymes like aldehyde dehydrogenase for NAD, and we'll talk about that, the NAD, a little bit later. But the main point is that we're not allowing your body to break down the alcohol, and as a result, what are we doing? We are accumulating the aldehydes in your body. So we kind of broken it down partly, and now we accumulate the aldehydes because we can't break the aldehydes down further. And aldehydes are extremely toxic to the body. So all those reactions that people get would be a result of this aldehyde accumulation in the body. So, again, the profound nausea, vomiting, sick to their stomachs, and people feel really, really sick when they've had disulfiram with alcohol. But, we've unmasked the effects of alcohol because generally your body breaks down the aldehydes. But when we don't break down the aldehydes, you can see what a huge effect it has on your body. Now, for this reason, you should not take disulfiram if you've recently had alcohol. I'd wait several days before I would have people take the disulfiram. There's no tolerance to this drug, and its effects get stronger the longer you've taken it, right? And it's absorbed very slowly and eliminated very slowly. So if you have taken disulfiram, it may still be in your body 2 to 3 weeks out from that last dose, right? So if you're going to start someone on disulfiram to treat alcoholism, you really want to make sure you leave a nice gap between the last drink and then the onset of starting the disulfiram. Now, unfortunately, the disulfiram doesn't reduce your cravings. All it does is it gives you a nasty reaction when you drink alcohol. So it's really a big whopping negative reinforcement there. And the thinking is that you get such a nasty reaction from drinking alcohol when you have disulfiram on board that you're going to avoid drinking alcohol. Well, in real life, what people do instead is avoid taking the disulfiram, right? That's just real life. So that's been the problem with using that medication, one of the problems. And they've switched to using subdermal implants, which can, deliver this disulfiram continuously in the body for up to like 3 weeks, right? And again, in the hopes of helping people conquer their alcoholism. Nowadays, there are other drugs as well to help treat that, such as naltrexone. So I don't think it's used as much because it can cause such toxic effects. And if someone does drink, while they have disulfiram on board, the effects can be so serious that they could end up in the ICU and in the worst case, even die. So you can see why there needs to be such caution when using this drug. It's also, can cause hepatitis in the liver, and with alcoholics who may already have liver disease, we have to be extra careful. It can also increase the half-life of medications that are cleared in the liver, such as caffeine and theophylline and acetaminophen, right? It can increase their half-life by 20 to 40%. So we have a lot of effects that we have to be careful about when we use the disulfiram. But the whole point of this is that when we accumulate aldehydes in the body, then we note that it is highly toxic to the body and your body reacts accordingly, right? So these aldehydes, as I said, need to be broken down, and we have the ability to break it down in the liver, a little bit in the gut, in the pancreas, and also in the brain. All right. I think this, especially that CYP2E1 system, is particularly important to breaking down the alcohol in the brain. The other thing that alcohol can do, small amounts of it, so most of it can be cleared by the enzymes we talked about, but there are small amounts of the alcohol that can actually react with free fatty acids and form what we call fatty acid ethyl esters. Okay, fatty acid ethyl esters. And we primarily use those ethyl esters to distinguish between chronic alcohol use and binge drinking. So it's a way we can look at the behavior patterns around drinking in users of alcohol. If you remember from previous episodes, the way we make triacylglycerols, right, fats in our body for storage, would be you take glycerol and you attach it to 3 fatty acids and you have triacylglycerols, right? So glycerol is an alcohol. You attach the fatty acids and essentially you have an ethyl ester, okay? We have diacylglycerols and monoacylglycerols as well. So, we actually have this reaction occurring with glycerol in our body, but we can have other alcohols combine with those fatty acids. So your ethanol can combine with the fatty acids as well. And then you form these ethyl esters that are bound to albumin, and also they bind to lipoproteins. They are involved in immunosuppression, and we can see a lot of this in alcohol use disorder. You note that people who use alcohol have a depressed immune system. They're more susceptible to infections, right? And these fatty acid ethyl esters also can cause mitochondrial dysfunction. And incidentally, this is how you make biodiesel, right? You take ethanol or some kind of alcohol and you combine those vegetable oils to it and you have your biodiesel. So we can have a small amount of the alcohol react with those fatty acids and form these fatty acid ethyl esters in the body, and those substances also can be toxic to the body. Okay, let's move on to some of the factors affecting metabolism of alcohol in your body. So a big one is, all right, obviously the amount that you're consuming. The more you drink, right, the bigger the effect. And if you get to a point where you're overwhelming your body's ability to clear the alcohol, that's when the toxicity becomes apparent to you. And you get those symptoms that we talk about that are involved in, making you feel very sick and giving you a hangover. So the amount is very important, and the speed with which you consume it is very important. Whether you consume it with food or not impacts the absorption, right? So if you're eating something, or you have a nice meal, big meal before you have your alcohol, then, or with your alcohol, then that food, the passage of food slows down, the movement of alcohol into the stomach and the absorption as well. So definitely taking it with food, with a meal is helpful. Obviously, the ability of the liver to make all those enzymes to process the alcohol would factor in as well. So if someone has liver damage or liver disease, that has to be taken into account. Or they may have a genetic predisposition to having less efficiency in clearing the alcohol, then that would be a problem as well. Carbonation also speeds up absorption. Now, that alcohol dehydrogenase enzyme, the rate with which it can clear alcohol in your body is 0.015 grams per 100 cc's of alcohol per hour. Okay, that's the rate that we can decrease your blood alcohol content. So if you take one standard drink per hour, one standard drink, it's going to take 1 hour for you to clear that drink and to metabolize it properly. Okay, now there are differences between men and women. Men make 40% more of alcohol dehydrogenase, and so they're able to clear the alcohol faster. The other thing, of course, is body composition. Okay, I'm the body composition queen, of course, so we have to talk about it. Now, alcohol really isn't taken up by fat tissue, right? So it's only going into the lean tissue. So for a fixed weight, the more fat you have, right, then really proportionally you're going to have a lot more of the alcohol going into your muscles and other lean tissue, organs and so forth. Okay, those would count as lean tissue as well. So you can see that impacts how alcohol affects your body. And obviously there are differences in body composition between men and women. Women tend to have more fat, higher percent body fat at the same weight, okay? And so therefore they're going to prioritize more of this alcohol being taken up by lean tissue, and that's going to impact them differently than men. Also, I see a lot of patients with sarcopenic obesity, which I've talked about in previous episodes. So with that, again, despite a higher weight, right, you don't actually have more muscle mass. You have a smaller muscle mass and you have a lot of fat, right? But within this smaller muscle mass or lean mass, then we have to get the alcohol into those tissues. So you can see the concentration is going to be higher in those patients. So body composition also, a lot of people don't think about it, but it really will factor in to how the alcohol is impacting your body, right? Sometimes people think that they can, add energy drinks or caffeine to the alcohol, so it gives you a false sense of energy and well-being, and you really don't feel so much the impact of the alcohol in your body. But that's a really dangerous thing to do because, they're, first of all, opposing systems, right? You're taking alcohol, which is generally a depressant, and then you're also taking these energy drinks, which are stimulants. And that's a lot of opposing stress to your cardiovascular system and can actually cause cardiovascular collapse. And also, when you're consuming some of these energy drinks, it masks the effects of alcohol. So people think they're feeling fine and they may start consuming more alcohol than they normally would if they didn't take those energy drinks. And of course, sometimes people think that, oh, well, the effects of alcohol, I don't like that feeling in my body, and I feel achy and tired, I have a headache. So I'm going to take some Tylenol or some ibuprofen. So Tylenol or acetaminophen, and where I grew up, that was paracetamol or Panadol. And also the NSAIDs, the non-steroidal anti-inflammatories such as ibuprofen. Those things are metabolized by the liver. So if you have alcohol on board and you're taking some of these medications that are also processed by the liver, then that's a big stress on the liver. And it's actually not very helpful. It'll make you feel better, but you might actually be causing more harm depending on the dose as well. Okay, so those are some of the factors that would impact, how quickly alcohol affects you. Now let's look at the standardization of alcohol when we talk about how much people drink in studies, right, in research articles. So one unit of alcohol is 10 milliliters or 8 grams, 8 grams of alcohol. The UK guidance for men and women would be not to exceed 14 units per week. And this is equivalent to 4 pints of beer or 5 large glasses of wine. That's about 14% alcohol. Okay, so that would be the guidance given in the UK for men and women. In the US, the guidance for men is not more than 24.5 units per week. And this is equivalent to about 7 pints of beer or 9 glasses of wine. So you can see the threshold is a lot higher in the US. Now, a standard alcoholic drink in the US is 14 grams of pure alcohol. And you would find that in a 12-ounce serving of beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, which is your standard pour, 1.5 ounce or a shot of 80 proof distilled spirits or hard liquor, right? And generally drinking 1 glass of wine per day, because a lot of my patients tell me, I just do 1 glass of wine with my dinner. So 1 glass of wine per day actually puts you in the top 30% of Americans per capita wine consumption, right? Taking 2 glasses a day puts you in the top 20%. And the average American actually consumes 9.5 drinks per week. And this works out to 494 drinks per year or 1.35 drinks per day. Okay, just to keep that in mind as we talk about the studies later on in relation to alcohol consumption. So again, the average American consumes 9.5 drinks per week, and this breaks down to an average of 1.35 drinks per day. Let's say 1 to 2 drinks a day. Okay, let's move on now and just talk about why alcohol is causing so much destruction to your body, right? It does so by increasing oxidative stress. And let's look at some of the ways that this happens. So first thing you should know when we are metabolizing alcohol is that we are consuming NADs. Remember those energy carriers that I talked about in that very first episode. So these NADs have the ability to take on protons and electrons and carry them to different systems, right? So when we are metabolizing alcohol, we are consuming NAD and we are generating a lot of NADHs. So we're actually reducing those NADs and we're forming a lot of NADH. When you have a lot of NADH, what happens? Again, from episode 1, we carry those electrons and hydrogens to the respiratory chain. And we actually are going to the electron transport chain, and there's increase in oxygen use and flux of electrons through the electron transport chain. Okay, now so you have all these electrons flying around. And when you have a lot of electrons, moving through the electron transport chain, you have a higher chance of stray electrons doing things they're not supposed to and landing up in places where they shouldn't be. Okay, and these electrons can actually end up being forming these free radicals, right, which are compounds that have just unpaired electrons in the orbits such that they become highly reactive and volatile. Okay, and those are called reactive oxygen species or free radicals. And as you know from previous episodes, these free radicals cause a lot of damage because, again, they're highly reactive and they can destroy many tissues. So when we are metabolizing alcohol, in that process, we are actually increasing flux through the electron transport chain, right? And we have a lot of these electrons flying around. We actually increase the formation of these reactive oxygen species, and then we can cause damage to the mitochondria. And we can cause damage to other membranes and enzymes as well, because as I said, these free radicals are quite toxic to everything they encounter. All right. Now, also, when we metabolize alcohol through CYP2E1, that cytochrome P450 system, when we do that, in the process of doing that, we are generating reactive oxygen species as well. So there we go. Whether we go through the regular route with alcohol dehydrogenase and aldehyde dehydrogenase, or we go through the cytochrome P450 system, we are generating a lot of reactive oxygen species, and as a result, we get a lot of oxidative stress to the body. Now, the other thing that alcohol will do is it will increase free iron, all right, iron, iron, in the cell. And iron also will actually promote the formation of a lot of reactive oxygen species. Okay, so this is from a 2017 article in the BMJ, and it's by Topiwala et al. And what they found was that even a moderate consumption of alcohol can damage the brain through free iron. And they measured brain iron content with MRI, and they also assessed people's cognitive functions with different tests, right, in this study. And they noted that alcohol consumption above 7 units or 56 grams a week was related to an increase in iron accumulation in the basal ganglia of the brain, right? And when they noted this high iron content in the basal ganglia, they also found that this was associated with poorer executive function, slow reaction speed. These people didn't do well on those cognitive tests. And the alcohol may also magnify aging effects in the brain. Okay, so as I said, iron, and maybe I'll do a whole episode on iron at some point, very interesting. but it is really good at generating free radicals and reactive oxygen species. And now with alcohol use, even moderate consumption, actually light to moderate consumption, right? What was it? 7 units, it said here, 56 grams a week. What was the average consumption for an American? Would be 1.35 drinks or 9.5 drinks per week, right? So I think we're right in that range, or maybe a bit more. And that would result in increased iron content in the basal ganglia. And we feel this might be due to alcohol's effects on hepcidin. Hepcidin, HEPCIDIN, is a hormone that regulates the level of iron in your blood. And when you have alcohol, it suppresses hepcidin. And as a result, we're going to have increased absorption of iron through the gut, increased dietary absorption. And the other thing that alcohol can do is it compromises the permeability of the blood-brain barrier. And so when we have this compromise to the blood-brain barrier, then iron can get through, right? The whole point of having the blood-brain barrier is to be selective as to what can get into the brain. But when you have a compromised barrier, then, all bets are off, okay? So that's pretty fascinating there. In fact, alcohol has also an effect on all tight junctions in the body. So tight junctions, we've mentioned this briefly, and if you want, I can do an episode on tight junctions. But tight junctions are seen in epithelial and endothelial cells in the body. And your epithelial cells, endothelial cells, they tend to abut each other very tightly, right? So if you imagine I'm a cell here and the cells next to me on either side, they have their shoulders kind of abutting mine very tightly. And we form these tight junctions. And the reason for this is, again, you are trying to form a barrier or a defense so that not everything can get in through this barrier and into the body. Well, when we have alcohol on board, the alcohol impacts the proteins that help form these tight junctions. So we have proteins that help secure and hold these tight junctions together. And alcohol is going to actually loosen up the tight junctions so that instead of having tightly abutting cells, right now there are gaps between the cells and substances can then leak in. And this is what we see essentially in leaky gut. So alcohol is associated with leaky gut, which is, as you all know, not a good thing because now you are susceptible to organisms that are in the gut, toxins that are in the gut leaking into the body. Well, alcohol is also going to impact other tight junctions in your body. So if you have leaky gut, because of alcohol, you have leaky brain because of alcohol. We just talked about that, right? So now you are impacting those proteins, the claudins, the occludins that are involved in tight junction formation in the brain. And now we have leaky brain, and substances that shouldn't be in the brain start to get in the brain, such as iron. Okay, we can also have leaky lung, right? And we have tight junctions in the lung. As you can imagine, we don't want anything to get into the lung tissue, right? So those tight junctions are very helpful. And if we have compromised tight junctions in the lung, then we are more susceptible to infections, for example, and other pollutants, toxins that we breathe in. And we do know that people who consume a lot of alcohol actually are much more susceptible to pneumonias and other lung infections, okay? So pretty much anywhere else you have tight junctions. So in the kidney, for example, there are parts of the kidney where you have tight junctions, and endothelial cells. These are the cells lining your blood vessels. right? And obviously, again, we don't want things that are floating in around in your blood, random things just getting into the body. And so we're going to have those tight junctions provide a barrier. But because you have alcohol on board, you compromise those tight junctions as well. And, there was a study done that looked at flow-mediated vasodilation. And this is a way to assess endothelial cell function. And what they found was even light drinking decreased flow-mediated vasodilation and therefore increase the endothelial dysfunction, right? So not a good thing. They found that there was a significant difference between the non-drinkers and light drinkers with regards to flow-mediated vasodilation, and that caused a lot of endothelial dysfunction. This wasn't a small study. They looked at actually 2,734 participants there. So again, there's always this idea that light drinking is okay for your body, but at the level of your endothelium, at the level of your blood vessel health, again, you also hear people say it's good for your heart, your cardiovascular system, it's good for your blood vessels. Well, it's not, because even light drinking will cause endothelial dysfunction. And then there was even a mention that atrial fibrillation, which is an arrhythmia of the heart, may be linked to endothelial dysfunction. And we know that really any drinking at all is going to be bad. It can provoke atrial fibrillation or this heart arrhythmia in people, right? So you don't want to drink if you have atrial fibrillation. Okay, the other thing is, because we have a lot of the reactive oxygen species floating around, guess what? Then your body's innate antioxidant system is going to be put to work, right? So glutathione, for example, is going to drop in your body because you're consuming all of this due to all the free radicals that you're forming. And so we're really stressing your body's own antioxidant system, and it's very easy to overcome that antioxidant defense. And as a result, now you put yourself at even higher risk for damage to your body. So alcohol is really impacting your body in negative ways, and they may be ways that you cannot see or feel in the moment, but it's still happening in the body. Now, in particular, let's talk now a little bit about aldehydes. Okay, so as I said, aldehydes are extremely, really toxic, and they form a lot of reactive oxygen species, really. The other thing that they can do is they can form adducts, 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 okay? It's similar to the advanced glycation end products, okay? Essentially, aldehyde can glom onto proteins and lipids and DNA and membranes and receptors, right? And in doing so, they change the structure, they change the function, they inactivate certain systems, right? So they can cause a lot of damage to the body. In addition, they can be involved in advanced glycation end product formation as well. And what they can do is they can also combine with the AGEs, the advanced glycation end products, and form these complex adducts, right? And these again will glom up and destroy a lot of the systems in your cell, in the body. These adducts actually are very hard to eliminate because they overwhelm and also inhibit the way your body breaks down protein. And as a result, they stay in your body for a very long time. And so we have this extended damage to the body. So as I said, we have increased reactive oxygen species. We have increased aldehyde adducts. We have increased aldehyde advanced glycation adducts, right? These complex adducts. And I might add, actually, I didn't say this when I talked about advanced glycation end products, and it's the same for these aldehyde adducts. These structures that are formed, they are highly complex, and many have not been classified, right? They're just quite overwhelming for chemists as well, because the reactions are so complex. We don't fully understand them, but there are just really thousands of them forming. And when you put alcohol slash aldehyde on board, we're accelerating and augmenting those reactions. Okay, so now I've given you really the picture of how alcohol can be or is destructive to your body. The next thing I want to do is address some of sort of the discrepancies that pop up when I hear people giving advice in the healthcare world about alcohol consumption. Okay, so for the first one, let's talk about alcohol and insulin slash glucose. It was noted in many studies, not all, but many studies, that when you consume alcohol, that it seems to help with insulin secretion, and it will also increase your sensitivity to insulin, so decrease insulin resistance, and therefore help with glucose disposal, so you have less hyperglycemia in the body. And it's been floated around that perhaps light drinking would be helpful to, kind of be a preventative measure against insulin resistance. Okay. So I do hear that, alcohol can help people manage their insulin better. So a small amount of alcohol should help. And, we've noted this effect. Like I said, there are some studies that show that this doesn't happen, but most people kind of agree that we do see this increased insulin sensitivity and better glucose disposal in the body. But there wasn't a clear indication of why this was happening. So I found this in the journal Endocrine Connections 2019 by Lang et al., and that's Lanng. And what they did, they actually were looking at, giving people alcohol via intragastric, they had a nasogastric tube and infused alcohol that way, or they gave them an IV infusion, okay? Just to kind of look at what was happening in terms of the hormones in the body, okay? And interestingly, what they noticed was that when you gave people alcohol, and it didn't matter if it was IV or intragastric, nasogastric, we actually increase FGF21. So FGF21, it's a hormone, the liver makes it, and when you actually consume things like fructose or carbs, or in this case alcohol, what we do is that we increase the transcription factor, carbohydrate responsive element binding protein, right? And we upregulate through this transcription factor the formation of FGF21. Now, the interesting thing about FGF21 is it seems to be some kind of a defense mechanism against high sugar levels in your body, and in this case alcohol as well, because what happens is they noted that you did have increased insulin sensitivity when you had high FGF21 levels in your body. The other thing about FGF21 that's really interesting is when you have high levels of that hormone in your blood, you actually have a decreased preference for sweet taste and for alcohol. So it seems like you have now this upregulation of FGF21, and normally you would then say, oh, I don't want those things that make me have high FGF21, and those things would be fructose consumption and carbohydrates and alcohol, for example. All right, so this seems like the perfect system, and it didn't matter whether you gave the alcohol IV or via, the GI tract. You still had this upregulation of FGF21. And what was important was they noticed this increased insulin sensitivity was not due to increase in incretin formation. So these are incretin hormones are actually secreted by the gut, and they can help increase secretion of insulin and also make you more sensitive to insulin. And the thinking was when you drink alcohol, maybe those incretins are upregulated and therefore you have that insulin effect. And in the study, they found that's not the case. It didn't change the incretin levels, okay? And you just, through this FGF21, had this increase insulin sensitivity, and we had a prolonged secretion of this FGF21. So, you give people the alcohol, whether it's by infusion, IV, or nasogastric, and the alcohol level rises around 40 minutes, but it's really at the 60-minute mark that you start to see that FGF21 kind of start to rise in the blood. And then it's prolonged. You still have that high level of 240 minutes out from the start of infusion, right? So this seems to be what is actually helping people manage their blood sugar levels better. But all good things, when tested and pushed to the extreme, right, start to fall apart as usual. So when you do that regularly, then people will start to have FGF21 resistance. Okay, so they may still have high FGF21 levels, but now at this point, just like insulin resistance, you have high insulin and it's not functioning the way it should be. Okay, so we have FGF21 resistance, and that also is correlated to metabolic syndrome in patients. So it's a good thing in the beginning, and your body's very smart and finds ways to protect you. But when you keep pushing it, and then you get to this point where you overwhelm your body's natural protective systems, then we get into trouble. Okay. The other thing I want to address now is alcohol and vasopressin. So if you remember, I believe I talked about it in the fructose episode. Vasopressin is a hormone that's secreted by your brain when you are dehydrated. So if you've not been drinking your fluids through the day, you went out for a long, hot hike, you came back and you haven't been hydrating, then you're dehydrated and your brain detects this and you're going to secrete vasopressin. Vasopressin signals your kidneys, hey, we're dehydrated, so you need to reabsorb as much fluids as possible. Don't make so much urine. Okay, then as I said earlier, the other name for vasopressin is antidiuretic hormone, because that's its effect on the kidneys. It says don't diurese so much, don't make so much urine, reabsorb as much as you can to protect the volume status in the body. Okay, so that's why we have vasopressin. And alcohol has been observed to have a diuretic effect. So people note that, hey, when you drink alcohol, you have to go to the bathroom a lot. You have to pee a lot, right? So probably alcohol is depressing vasopressin secretion. It's inhibiting vasopressin secretion, and that's why you get dehydrated from the alcohol. Well, it's actually quite difficult to measure vasopressin because there are very few reliable assays for vasopressin. So for a long while, people weren't quite sure exactly what was happening in your body. But now I think the tendency is, instead of trying to measure vasopressin, we are measuring something called copeptin, C-O-P-E-P-T-I-N, copeptin. So copeptin is actually part of the precursor form of vasopressin. So before arginine vasopressin is the full name, before that is formed, right, we have a precursor form that we'll just call precursor vasopressin right now, all right? And copeptin is part of that precursor molecule. And then we cleave off, or we cut off the copeptin part, right? And we have the vasopressin part. Now your brain secretes both the copeptin and the vasopressin in a 1-to-1 ratio. Okay, so because it's formed from the same, it's in the same molecule, and then you just cut it, right? And now we have copeptin and vasopressin, and your brain secretes both in a 1-to-1 ratio. So we can utilize that fact and measure copeptin because it's quite easy and we get reliable measurements of copeptin. So if you measure copeptin, it's an accurate proxy for the amount of vasopressin that's secreted, since they are both secreted together in a 1-to-1 ratio. Okay, so we're kind of working around the inconsistencies of vasopressin measurement by using copeptin instead. All right, so this was a study that was in the American Journal of Physiology. It was in their renal physiology edition from March 2020, and they took 10 healthy men and subjected them, all of them, to 4 interventions in random order. So number 1 was beer only, intervention 2 was beer with water, intervention 3 was beer with stock or bouillon or some source of sodium, and intervention 4 was water only. Okay, and they had a 48-hour period between each intervention. So it's kind of a crossover study. And for every intervention, they kept the fluid volume the same for each intervention. And they also adjusted each intervention so that when you had the beer interventions, those interventions had a blood alcohol content of 0.8%. So they kept that stable in all the interventions with beer. And this experiment was done over 720 minutes, where they were drawing blood at various time points throughout the study. They noticed that at 90 minutes out, there was actually no difference in copeptin secretion between all groups. So it's the same at 90 minutes out. So, if you have, dehydration and you're not drinking enough water, again, we stimulate vasopressin formation, right? But if you drink a lot of water, we suppress that. We don't need it. So your body's going to say, well, I'm not going to secrete that vasopressin. So it turns out that, okay, for the same volume, if we're using alcohol, same thing. We're not going to see an increased suppression of vasopressin or copeptin in this case, right? Than we would see with an equivalent volume of water that is ingested. Okay, so between all groups at 90 minutes, the copeptin levels were the same. Yet, at the end of the study, we noted that the people, when they went through the beer interventions, they had increased total urinary volume. So they actually peed out more urine, right? And they had increased, at the end of the study, increased plasma copeptin and also sodium. And they also had increased urine osmolality. So what was going on? Because at 90 minutes out, there was no difference. And it turns out that actually we have the copeptin suppression, of course, but this is prolonged with alcohol on board. So you drink water and you suppress the vasopressin or copeptin, right? You drink alcohol, you suppress the vasopressin or copeptin. But the alcohol has the effect of suppressing the copeptin / vasopressin for a longer and extended period of time. That's the main difference. So you have this extended copeptin suppression, and now what happens? You're peeing out more, right? That's why you have increased total urinary volume, because for a longer period of time, you are suppressing the vasopressin. Okay, and because you are losing more urine, more fluids from your body, guess what? Yes, your body senses that. Also, the sodium levels in your body rise, right? So you have increased sodium levels in the body, and the body goes, "Ooh, we lost a lot of fluid. Sodium's going up. Yeah, what do? Okay, we're going to have to use some vasopressin." Okay, so after this prolonged suppression, and we are losing fluids as a result, your body kind of has this compensatory reaction and says, "Oh my God, we need vasopressin on board." So you actually secrete more vasopressin now, and you have increased water retention as a result. So these are in response to that prolonged vasopressin suppression. I hope that made sense, right? So that's why people actually tend to pee out more total urine when they've had alcohol. They noted in the study that additional sodium consumption through the stock or bouillon and water consumption did not change the alcohol-induced effects. And the increased alcohol did increase thirst perception. But taking the additional bouillon or stock and additional water, you always hear, okay, you actually had a lot of alcohol, so drink a lot of water. It really did not change the alcohol-induced effects with regards to vasopressin. Okay, so I hope now you understand that that's clear. Let's move on to something else. This is also advice that I've heard and seen people give with regards to consuming alcohol. And it's with fructose. Okay. So I've seen this, online. I've heard people say this, and I just want to clear this up, okay? There's this idea that when you consume fructose with alcohol, that you're going to increase clearance of ethanol from your blood quicker, right? It's going to increase your metabolism of alcohol. And so then the conclusion is, therefore, one should consume fructose when you are drinking alcohol, because it'll help you get rid of the alcohol faster. Okay, let's take a quick look at that. So it is true, right? If you consume fructose with alcohol, you do have increased metabolism of the ethanol or the alcohol. And they've shown this with various studies. So here's one where they use rat hepatocytes, and they noted increased alcohol oxidation by more than 50% when you added fructose into the mix, okay? So yeah, it seems to be helpful. We also noted that there was increased glucose production, increased glycerol, lactate, and sorbitol. Okay, remember polyol pathway? Bells should be ringing in your head. Okay, so as part of the metabolism of fructose, we take fructose and we make glyceraldehyde. Okay, and then using the aldehyde dehydrogenase enzyme, we can convert that glyceraldehyde into glycerol. And we can take some of that glycerol maybe and make glucose, but that glycerol also is tagged to fatty acids, and we make triacylglycerols. We increase formation of fat in the body, okay, here in the liver. Okay, so we do have the fructose, and it's, as part of its metabolism, we make glyceraldehyde. Glyceraldehyde is now going to be converted by aldehyde dehydrogenase to glycerol. And aldehyde dehydrogenase enzyme gets a little bit upregulated, so that part will also help in metabolism of alcohol. So that's one thing. What else does fructose do? I've said this over and over now, and you have heard the polyol pathway in multiple episodes by now, right? Fructose, right, can be converted back to glucose via the polyol pathway. The intermediate there is sorbitol, which is a sugar alcohol. And sorbitol is highly, highly inflammatory. Sorbitol has huge osmotic activity, and when it accumulates in cells, it makes those cells, the membranes and so forth, the different structures swell up, and we damage the cell. Okay, so we damage nerve cells, we damage eye cells, kidney cells, and any other cells where the sorbitol is accumulating. Okay, so obviously that is not a good thing. But also in the process of taking fructose to glycerol, and in the process of converting fructose to sorbitol, what do? We actually have to use a lot of NADH. Remember those energy carriers, right? NADH. We use the NADH and we generate a lot of NAD. Remember what we need for alcohol metabolism? We need NAD. Okay, so if we're generating a lot of NAD because we're consuming a lot of NADHs through fructose metabolism, whether you take it to sorbitol or whether you take it through glyceraldehyde to glycerol, right? Then we're going to increase alcohol metabolism. We're going to prioritize that, right? But is that a good thing? Because we've just formed a lot of fat in the liver, and we also have increased sorbitol in the body. And the other thing, of course, you should remember is that fructose is one of the most easily glycated sugars in your body. So got a lot of advanced glycation end products. And remember all those aldehyde adducts and the advanced glycation end products that are combined with the aldehyde adducts and all that. Yes, chaos. Not a good situation. So we do not want to combine fructose with alcohol just to clear the alcohol faster, right? In fact, when people have consumed fructose, when we've noticed increased fructose intake with alcohol, you have a high prevalence of metabolic syndrome, right? Duh. Okay, because that's not the way that you want to do that. Okay, so again, please do not tell people to consume fructose with their alcohol to clear the alcohol faster. You are probably causing more harm that way. All right, since we talked about fructose, what else do we need to talk about? Why don't we go to uric acid as well? So as you can see, when we metabolize the alcohol, we accumulate what? NADH. Yet again, NADH. That energy carrier. Remember episode 1? Sometimes people go, why do you do? Are you teaching a course? No, I'm trying to set some foundation so that as we go along and we talk about bigger topics, I don't have to go back and explain everything all over again. We've built up a foundation, and so now we can have really, interesting and meaningful conversations about these bigger topics. So back to NADH. Metabolizing alcohol would generate a lot of NADH and decrease what? Actually, I mentioned this in one of the previous episodes. We're going to decrease NADs, right? Because we're using up the NADs to metabolize the alcohol. Where else do we need NADs? Well, we need NADs in glycolysis. Without the NAD, you cannot run glycolysis. Okay, so as a result, you can't run glycolysis if you have alcohol on board. And now what happens? Yeah, your ATP levels drop. Ooh, ATP levels drop. That ring a bell? If you look at the uric acid episode, right? Again, this is why we're building that foundation. So we see the connections, because your body is a connected system. It doesn't function in isolation. Okay, ATPs drop and purine catabolism to the rescue, right? Also, as part of the metabolism of alcohol, remember, we form acetate, yeah? And that acetate can become acetyl CoA via the formation of acetyl AMP. AMP. Remember AMP. Again, we can take that AMP and run it through the purine catabolism pathway and make uric acid as a result. So when we drink alcohol, we can promote the formation of uric acid. And this is particularly true with beer, okay? Specific to beer, especially because it's with all alcohol, but especially with beer, because it turns out that beer happens to contain a lot more purines. And so you have more of the purine accumulation. And then as you break that down, you have more uric acid being formed. Okay, so I just wanted to tie all that up with you so you can now understand more fully the effects of alcohol on your body. And the reason I do this again is there's a lot of ambivalence about alcohol use, and I want to focus on the medical world especially. Oftentimes, when you talk to practitioners, they will say, or either they'll tell me or they'll tell patients that, well, alcohol, have it in moderate amounts because it can protect your heart, and it can protect your blood vessels, and it can be good for you in small amounts, but just don't have too much. That is the standard advice that I have heard in the medical world, and it kind of blows my mind because if you look at what alcohol actually does in your body, there's no way you would actually say that. But somehow we have this recommendation that's floating out there. And most of this is coming from studies, and might I add, observational studies, okay, on the effects of alcohol and how it relates to heart health, for example, okay? All right, observational studies. The problem with observational studies, where do I begin, right? First of all, a lot of this is we're getting information through people's self-report, which probably isn't as accurate as we would like to think, right? And then also, there are so many confounding factors that we really don't take into account. Maybe we're not even aware of. Sometimes we try to adjust for those confounding factors, but really, a lot of times it's hard to separate them out. So you have a mix of studies then with regards to alcohol. You have studies that seem to show some benefit to heart health, and then there's some that show no benefit or maybe harm. Okay, and then generally people have said, well, we think it does help the heart at low doses. Okay, so now lately in observational studies, we've added a new tool, and this is called Mendelian randomization. Okay, and this new tool is helpful in those observational studies because when we're studying human beings, a lot of times we can't do RCTs ethically. So the best we can do is use those observational studies, right? But as I said, with all those confounding factors, how do we interpret those studies? And Mendelian randomization is a more recent tool to help us separate out some of those confounders. Okay, so really, Mendelian randomization is the use of genetic variants to examine causal effect of modifiable exposure on disease in observational studies. Okay, so what do I mean by that? Well, we're actually going to look at genetic variants and use those to help us kind of screen out some of the confounding factors. Okay, so in the case of alcohol, we can look at the aldehyde dehydrogenase gene. Okay, remember that that's the enzyme that helps you take aldehyde to acetate. So it's part of clearing alcohol in your body, right? So some people possess a point mutation in the aldehyde dehydrogenase gene, and then they have an inactive enzyme, okay? And that enzyme I'll just call ALDH2, ALDH2, okay? So they have that inactive ALDH2. Okay, now because we get an allele from each parent, right? If you get two inactive ALDH2s, then you're homozygous, right? And if you only have one inactive one and one active one, then you're heterozygous for that gene. Okay, so obviously, if you are homozygous and you basically don't have the function of that gene, of that enzyme, aldehyde dehydrogenase, then what happens? Basically, it's like having disulfiram in your body all the time, your whole life. And what does disulfiram do? It doesn't allow the breakdown of aldehyde to acetate, and so the aldehydes start to accumulate in the body. And we saw how toxic that is, right? We saw that now people start to have nausea, vomiting, throbbing headaches, yeah, and they can have cardiovascular and respiratory collapse in the extreme. Okay, so these are very severe reactions. When you do not have the enzyme to clear the aldehydes, you essentially have, this disulfiram effect in your body all the time. So any consumption of alcohol is going to be very uncomfortable. There's profound flushing, and people are vomiting and throwing up and sick, really, really sick. So people who are homozygous for this point mutation in the gene, and they can't process the aldehydes, they actually accumulate 18 times more blood alcohol content for an equivalent amount of alcohol consumption than someone who has that functional gene. Okay, so they really have a very profound effect when they drink alcohol, and as a result, these people tend not to drink. Alcohol consumption is zero in most of these people, and the risk of alcoholism is very, very low. Does it happen? Yes. Okay, so these people do not drink because they get so sick from it. But if, for some reason they force themselves, well, they could get very sick. Some of them could die even. But we can then see the effects of alcohol on these people and know that it's the alcohol that caused those effects, right? And if we look at heterozygotes, they're not as sick, but they still get very sick. They accumulate like 5 times more blood alcohol content than someone who is completely normal for that enzyme. So they still will have some disulfiram effect in their bodies. And they tend also not to drink. They tend not to have alcoholism. However, if they are in the situation where, despite having that gene, despite having that heterozygous state and having that disulfiram reaction, they still drink, then the effects that we see in that population, we can attribute to the alcohol. Okay, so it can really help us out in these observational studies by kind of teasing out some, not all, but some of the confounding factors. So Mendelian randomization is a very useful tool now, and we're starting to see more and more of this in these observational studies. So I'm going to reference a study from JAMA, March 2022. And this was a study that particularly looked at confounding in epidemiologic studies of associations between alcohol and cardiovascular disease, because they wanted to address this question of, well, does it protect your heart at low doses and then become problematic at high doses? And this study used Mendelian randomization to kind of tease out some of the confounders. They also noted that, people who drank light amounts, the lighter drinkers, were actually better educated and they were more concerned about their health. So they had better health practices all around, better nutrition, maybe they exercise more. And when you adjust it for those factors, really any positive effect of alcohol on cardiovascular health was actually gone, completely gone, right? So they found in that study that there was a causal association between alcohol intake and risk of hypertension, cardiovascular disease, and even a very small increase or modest intake of alcohol would actually increase your risk for coronary artery disease. Now, the risks were lower at lighter levels of drinking, but they increased exponentially, not linearly. They increased exponentially with increasing alcohol intake. And most importantly, they stressed there were no benefits at light to moderate levels of drinking. Zero benefit. So, and that was a big study because they used like 370,000 people from the UK Biobank. Okay. So, anytime now I hear someone talk about, well, at low doses, it can be cardioprotective. I reference the study, and you remember that with even light doses of alcohol, what did we see? We saw endothelial dysfunction. Okay, and endothelial dysfunction is affecting your cardiovascular system. So you may not see it, but it's happening even at very low doses. Okay, the next thing I want to talk about is alcohol as a carcinogen. I thought this was obvious, but turns out that it's not quite so obvious to a lot of people, and even more distressing, it's not being very obvious to healthcare professionals. So alcohol is a group 1 carcinogen. I'm going to say that again. Alcohol is a group 1 carcinogen. And usually when I say that, people look at me and go, Well, a group 1 carcinogen is one in which there is no safe low dose of administration. There's no safest low dose of administration, right? So you can't say that, well, if you keep below this level, you will not have risk of cancer. That's a group 1 carcinogen. And other group 1 carcinogens are tobacco and asbestos. Okay, so when a patient asks about drinking, as I said, sometimes they are given recommendations such as, well, in small amounts it should be okay. And so patients walk around thinking, oh, I only have 1 to 2 drinks a day, maybe a little bit more over the holidays or when I'm on vacation, but I'm really not a heavy drinker. Okay, remember, 1 drink a day already puts you in the top 30% for wine consumption, right, of Americans. But anyway, I'm not really a big drinker, and small amounts are okay. Well, Dr. Lowe, what's the lowest number of cigarettes that I can smoke and be okay and not, have like lung cancer risk? Oh, that would be 0. Oh, Dr. Lowe, what's the lowest dose of asbestos that I can inhale, right? And not run the risk of cancer, mesothelioma. Oh, that would be 0. Oh, Dr. Lowe, what's the lowest dose of alcohol that I can take to be healthy and not run the risk of cancer? That would be 0. It's a group 1 carcinogen. It's in the same group as smoking, tobacco, and asbestos. You would not recommend a few cigarettes. You would not recommend a few exposures to asbestos. Should be okay, don't worry about it. Right? So why are we saying that light alcohol is okay? It's really distressing to me that we're giving that information. It's not very popular advice to give, okay, but it's the right thing to do. I mean, because it's been involved with development of lots of cancers, primarily the head and neck cancers. So these are oral, pharyngeal, laryngeal, esophageal cancers, liver cancer, okay, highly associated with drinking. Breast cancer, also another big one, colorectal, and also we're seeing accumulating evidence for increased risk in melanoma, prostate cancer, pancreatic cancer, kidney cancers, right? So let's look at breast cancer, for example. For each alcoholic drink consumed per day, the relative risk is increased by 7%. 2 to 3 drinks per day puts you at a 20% higher risk of breast cancer than those who didn't drink. I have a colleague, and she was diagnosed with breast cancer. Unfortunately, was treated, and at one point she said, "Oh, no, I can't drink. Yeah, my oncologist told me I can't drink because she had this history of breast cancer." So I said, "Okay, so how come your patients, you tell them it's okay to have like small amounts of alcohol?" And she looked at me and she said, "Oh my God, I didn't put those two together." I was like, "Yeah, because it's a carcinogen and you shouldn't be telling your patients they can have small amounts. You can't have small amounts, right?" So again, I want to stress that because we're the ones giving those recommendations. Now with breast cancer, some of the ways in which you're increasing your risk is obviously, again, the aldehyde accumulation. I told you it's highly toxic, causes mutations to your DNA, and we have that when you drink. You have increased reactive oxygen species. You have those aldehyde adducts, again, all of these damaging your DNA and other cell structures. Also increases estrogen, and you have increased risk of nutrient imbalances. And also, incidentally, there are contaminants in alcohol such as nitrosamines and phenols and hydrocarbons and asbestos fibers, right? So those are just some of the ways, but we extensively talked about how alcohol increases oxidative stress and damages your body. So it shouldn't be a surprise that it is a group 1 carcinogen. Okay, and then I get this from patients, "But Dr. Loh, the French drink all the time and they don't have a problem with cancer." Okay, let's take a look. And it turns out actually that they do. They have a high preponderance of head and neck cancers, right? And in fact, Europe, interestingly, has 1/10 of the world's population and 25% of the global burden of cancer. Okay, now in Europe, the European Commission notes that, and we've seen this in previous episodes, I mentioned this, that 40% of Danish adults report regular heavy drinking. Now, the World Cancer Research Fund International notes that Denmark happens to have the highest cancer rate of men and women. It's 334.9 people per 100,000. Okay, so they have the highest cancer rate of men and women in Europe. They also drink the heaviest in Europe, and many groups have noted that alcohol, also tobacco, but alcohol use causes a huge cancer burden in Europe. Okay, so all those people who are telling me, "Oh, but people in Europe, people in France," yeah, they have a huge cancer burden as well. All right, so enough about cancer. Let's go on to talk about the brain. The brain. Don't want to go on too long about it, but there's some really interesting things here. We know, of course, I hope you know, that alcohol shrinks the brain. Yeah, so you drink alcohol, your brain shrinks, right? As if, all the other things weren't scary enough. So this is from March 2022, Nature Communications. They looked at 36,678 healthy middle-aged and older adults from the UK Biobank. And what they found was alcohol intake is negatively associated with global brain volume measures. So the more alcohol you take, the smaller your brain. And there were regional gray matter volume differences and white matter microstructure differences. So you actually have, change in the brain when you drink alcohol. And you could see this at 1 to 2 alcohol units per day. 1 to 2 alcohol units per day. Was the average American consumption about 1.35, 1 to 2 drinks per day? I think we would fall in that range. And you see shrunken brain. Okay, why is this happening? Okay, let's go back to endothelial dysfunction, for example, right? So when you have endothelial dysfunction, you have dysfunction of your blood vessels, and that's throughout your body, including the blood vessels that supply your brain. And so we have, decreased perfusion to the brain, and then brain cells die. And also we have a neuroimmune response in the brain. And this is fascinating to me because it particularly involves microglia. So microglia are immune cells that are found in the brain. They are what we call tissue-resident macrophages of the brain. Now, I did a talk once and it was a survey on macrophages, overview, just a particular interest of mine. And you can find that on YouTube if you search the Magical Mystery Macrophage Tour. Okay, Magical Mystery Macrophage Tour. And there I give you a survey, just an introduction to macrophages. And I will probably have to do a part 2, 3, 4, 5, 6, 7, 8, 9, 10. Because again, what I mentioned in that talk was just a speck of the macrophage world, right? But nonetheless, I do introduce microglia there, and these are actually macrophages. They are tissue-resident macrophages that live in your brain and do some very important functions in the brain. They're involved in homeostasis and they're involved in immune responses in the brain. So it turns out that microglia, when you introduce alcohol, right, alcohol induces aberrant synaptic pruning in the brain, and these microglia now engulf synaptic structures. So your microglia, especially during development, are constantly pruning out, different synaptic connections that are not used, right? And this is part of how your brain develops. But we continue to have synaptic pruning throughout life, right? But when we have alcohol in our system, then we actually induce these microglia to have this pruning effect, an aberrant pruning effect, where they start just engulfing different synapses and eating up the synapses in the brain. So we see a neuroimmune response in the brain. Now, here's a study from Biological Psychiatry, Warden et al., 2020. This one, they looked at mice, and what they did was they had 2 groups of mice. One group was alcohol dependent and one group was non-dependent, okay? And they gave the mice a substance called PLX5622. All right, it basically just removes microglia from the brain. Okay, that's what it does. They gave both groups of mice this PLX 5622, okay, to remove microglia in the brain. And they did this over 4 weeks. With the non-alcohol dependent mice, there was no alteration in drinking pattern. With the alcohol dependent mice, they noted no increased drinking. So they were drinking at the same level, but when introduced, and given alcohol to just imbibe, I suppose, they actually didn't have an increased level of drinking. In addition, they had decreased anxiety-like behavior associated with withdrawal. So they really had less of this negative effect from withdrawal from alcohol. They did have decreased immune response in the brain. There was less inflammation noted in the brain. There were decreased inhibitory GABA and excitatory glutamatergic signaling in the brain. And so the thinking is that actually the reactions of the microglia are involved in the formation of addictive behaviors. Okay, in this case in alcohol, but in other addictions as well. I'm going to probably do an episode on neuroimmune responses in the brain. As I said, I have a particular interest in macrophages, and obviously the macrophages in the brain are called microglia, and they are very, very fascinating to study in relation to neurodegenerative diseases and so forth as well. But in this case, with regards to alcohol, it is this immune reaction, something that the microglia are doing, that is actually involved in the addictive behaviors. And we'd never seen this before, right? We never thought of addiction as a neuroimmune response of the body, which is why it's so fascinating. Right? And also, there are different populations of macrophages in the brain. When you increase drinking, for example, when you drink, you also kind of recruit different types of macrophages to the brain. There's a type that we call perivascular, and they surround the blood vessels, right? And remember that alcohol causes endothelial dysfunction, and then we have these immune cells now accumulate around the blood vessels, the perivascular macrophages, because they detect that there's something wrong with those blood vessels. Well, if those people have strokes, right, then they actually have worse outcomes from strokes. They have larger infarcts, okay, more extensive strokes. And because that area of the brain is already compromised, and there are immune reactions that are going on there that, if a person then follows up with a stroke, they actually do worse. Okay, so this idea that alcohol is safe to drink at lower levels should be just, thrown out the window. I happen to have a window here, so let's just throw it out the window, right? We'll throw it out the window, and we really should not be making any recommendations beyond no alcohol consumption. Now, not everyone is going to abide by that recommendation, and that is fine. People get to choose, but doesn't mean that you give the most popular advice. You give the recommendation based on the science. And people can choose if they want to follow it or not. I'm perfectly happy with that. You just don't give people erroneous information. You don't give the popular advice. You just tell people the truth, because your job is not to be popular. Your job is to tell people what the science says, and people can make their own decisions. Okay, I trust that they will make the best decisions for themselves, whatever that might be. Okay, now if you want to stop drinking alcohol, and I want to first point out that dry January can happen anytime, at any point in your life. You make a decision to be healthier and to decrease your risk of disease, of cancer, for example, of shrinking your brain. You want to stop using alcohol. You can make that decision any point in time. You don't have to wait for dry January. If you are a fairly consistent alcohol user, moderate drinking even, I would say please talk to your healthcare provider before you actually cut off the alcohol on your own. Okay, because a lot of people report moderate drinking. I don't quite know what that means. I don't know if it's really moderate because everybody's level of moderate is different. So I tend to be quite conservative here. If you're not sure, if you're having more than, let's say, a glass of wine per day, then you just at least want to have that conversation with your healthcare provider, because if you actually are a chronic drinker and you suddenly cut off the alcohol consumption, you might go into withdrawal, and at the end of the spectrum, some of the withdrawal symptoms could include seizures, coma, and so forth. So it can be very dangerous if you're just trying to go cold turkey on your own. So I highly advise you to have a conversation with your healthcare provider so that you can do this safely. Okay? So I hope that if you have been doing dry January, that this might actually encourage you to continue extending that to the rest of your life. If you're not doing dry January, again, think about what alcohol is doing in your body, and hopefully you'll find the best decision for you with regards to your consumption and your health. My recommendation is the same that I give to all my patients. There is no safe lowest dose of alcohol consumption, and it causes profound dysfunction in different parts of your body, and it should be avoided. Okay, before I end, I just want to remind people I have live stream events. You can find the schedule on my website, vivianlohmd.com, VYVYANELOHMD.com. And I am happy to answer questions and take requests for topics for future episodes at those live stream events. So I hope I'll see you there. And also, if you have suggestions for guests that you'd like to see in future episodes, I am lining up my own, group of people that I will be bringing onto the podcast. But if you have suggestions, I'd be happy to hear them. And for now, signing out from VLMD Rounds, I am Dr. Vivian Loh, and I sing the body electric. See you next time.